So let's see, first slide then. And click. And click. Okay, so I want to ask you all a question this morning. How many of you have ever heard of that data is the new oil? Well, I think it is, except that when you try to pour it or share it with others, it's really not very viscous. It's very difficult to move oil from one place to another. Think about the pipeline project and how complicated that is. Then we move to the data world. It's quite complicated, and it shouldn't be. Why is that? So we have to ask ourselves the question. Have you ever thought about this? Next slide, please. Next slide. Don't worry, your information will be kept strictly confidential between you, me, the residents, the nurses, the staff, people in our marketing department, researchers, people at our billing company, people at our transcription company, people at our record archive, people at your insurer, and my cat. Next slide. In 2017, Forbes magazine post, Bernard Marr notes that data democratization means that everybody has access to data, and there are no gatekeepers that create a bottleneck at the gateway to the data. It requires that we accompany the access with an easy way for people to understand the data so that they can use it to expedite decision-making and uncover opportunities for an organization. The goal is to have anybody use data at any time to make decisions with no barriers to access or understanding. Let's think about this throughout this conference here. I really want to lay a groundwork for you in how to think about the information that is going to be coming your way over the next 2 days. This is really what this talk is about. Next slide, please. At the root of data democratization lies the idea of sharing data. It is impossible to think about moving and having access to data if we're not sharing it, even within an organization. Next. Sharing data and understanding of what these data are within an organization to combat so-called data silos and allowing different groups within an organization to leverage and interpret data. But as you might have asked your mother at some point in your life, next slide, why do we have to share? Next slide. How many of you know what this map is of? Anyone? It's not the Titanic. This is Philadelphia's 7th Ward. Data sharing has been around for a really long time at the local level. Click. In 1899, W.E.D. Du Bois provided one of the first examples of data sharing with a map of the locations of African American households of color, and they were color-coded by their social class based on in-person surveys of Philadelphia's 7th Ward. This map helped understand the impact of housing policies on the people of the 7th Ward, specifically by showing the limitation of opportunities for individuals based on geospatial analyses of demographic and economic patterns that were a result of a map like this that was shared. 1899. It's 2021, people. We've got to be able to catch up with the past. Let's talk about sharing. Next slide, please. Russo and colleagues from the Boston Consulting Group report that for their part, businesses have so far focused primarily on the economic value creation from their own data. But with the data's expanding role in achieving environmental, social, and governance goals, companies need to broaden their horizons. Sharing with companies and organizations participating in ecosystems and public-private partnerships can both be a key part of a company's total societal impact strategy and a foundation for sustainable business model of innovation. So thinking about data and data sharing as a public good activity is a way to allow that energy or synergy to exist in our community. Lots of people get community benefit for lots of activities and things they sponsor in the public health space. Why not data sharing be added to that list? Next slide, please. The idea of data sharing and democratization shouldn't feel like a burden as much of it is an opportunity. I think we have to shift the mindset away from a burden to the opportunity. What is it that you can get by sharing your data to a bigger collective? And what is it that others can get for that same thing? Okay, thank you. So it shouldn't feel like the thing on the left. Click, please. It should feel like on the right. Click. Thank you. Next slide. Part of the value proposition for your organization's data may be entirely internal. The data have value for your processes, procedures, and proposals. Everybody knows your organization survives and thrives on its own data, thereby creating its value. Thank you. But a growing body of work suggests that the value of your data may increase through sharing as other organizations can lean into the information that you have and in so doing find extrinsic value in that data. People always ask me, how can I monetize my data? Well, one of the ways you can monetize data is by allowing people to experience its value. And then you understand how to price it. It's hard to value something if you know its worth. This is a really important idea about how you curate your own data. It also speaks to your commitment to data quality. Nobody wants to buy stuff that's not very good quality. Everybody knows you'll have to return that or throw it away next week. Not so great for the environment. So why not think about data quality from a value perspective? If you're going to share that data, let others tell you what its value is. That's part of the learning process. Next. Knowledge is like money. To be of value, it must circulate. And in circulating, it can increase in quantity and hopefully in value. This is an old U.S. writer. But in modern speak, Snoop Dogg said it best. It ain't no fun if the homies can't have none. Next slide. Russo and colleagues from the Boston Consulting Group illustrated 5 pathways for how shared data can generate more value. So you can see these pathways here, but the main idea of this slide is to really think about sharing data can create trust. If someone else can use your data and leverage it for their own good, they begin to trust that your organization is collecting and doing what you say you do. It can also facilitate coordination. When you have to harmonize 2 data series from 2 different corporations, you're forced to work together to make that happen. It can also raise awareness for your organization because you have data now that are available that nobody knew you collected. You can also validate hypotheses by having a wider set of variables to consider in your own analyses or your own evaluation of programs. And of course, it can enable innovation. I'm going to show you many examples of how local organizations are innovating around the data sharing space to motivate the work here at this conference. Next slide, please. While we continue to see researchers increasingly sharing data, the majority of the research community are not yet managing or sharing data in ways that make it findable, accessible, or reusable. The utopia of findable, accessible, interoperable, and reusable, that's FAIR data, is still some way off. So don't think you've missed the bandwagon. We're still able to get on the bandwagon, but this is a lot of work. It isn't easy. It is going to be hard. But I'm going to tell you about some ways and some strategies to improve the ability to share. Next slide, please. So why is sharing data so hard? It's not a whole lot different than sharing your toys when you were younger. Samantha Barnes, staff writer for the International Banker, writes about the importance of data sharing for tomorrow's economy. In her post, she mentioned some clear barriers to data sharing, one of them being data silos. Closed walls around data that make it difficult to access data both within and outside an organization. Now let's just be real with each other here for a minute. How many of you have ever wanted to do an evaluation or an analysis in your organization for a particular program only to find out that you were not able to have access to those data? You had to call somebody else. You had to call somebody else, and you had to call in a favor even to do the work. This is an example of a data silo byproduct, and you're all suffering from this. And this has been reported several times in the literature. Know that you are not alone. Software applications designed to support one type of outcome at a single point in time, and the data gets locked in place. How many of you have ever thought, okay, this is a one-off project, I need some support from IT, they're gonna jerry-rig something and come up with a solution, and I'm gonna be able to do my work. Only to find out that it was successful. Only to find out that you're gonna repeat that next year. Only to find out that the IT person says, oh, they're gone. You have to use the legacy that you created a year ago. And then suddenly, how do you share that? You don't even know how it was created. So these pieces here are an example of the locked in place idea. Vendor lock-in is the worst. It's the worst. Because you have data in a system that you own or that you have leased some software package, and your software doesn't play nice with another organization's software. So the easiest way to say you don't want to share is you blame it on the software. People do it all the time in the electronic medical record space. How many of you have ever had a diagnosis from one hospital to take a disc to another only to find out they couldn't read it? So they had to repeat your procedure, and you paid another copay. Lack of data sharing is expensive. You think data sharing is hard, try not sharing. Organizational structure can also inhibit data sharing. If the IT owns the data and you don't have an IT badge or an IT credential in your organization, you may not be able to access data that you readily need for your proposals. And you're on the same team. I don't understand that. Next slide, please. So why is data sharing so hard? A 2018 Springer Nature study of frequent data sharers found 5 challenges hampering insight generation in a timely manner, including data organization and presentation issues, not understanding how to find the data, copywriting and licensing issues. How can I leverage this information legally and safely? How do I find or access data from the correct source or repository? How many of you ever in your organization said, I need to find the data, and somebody says, check the Z drive? Okay, you're with me. Okay, the lack of time to deposit data, you're running out to another project and you don't know who to throw the data to, so you give it to your RA, and the RA says, where's the Z drive? Where do I put it? I don't know how to get this data into the Borg. Cost of sharing the data. Everybody says it's expensive to share, but I think it's more expensive not to. And we're going to talk about some opportunity costs for not sharing. Next slide, please. Oh, and then of course there's the pesky privacy issues and the understanding of laws like HIPAA and FERPA. If I ever hear another person say, well, it's FERPA, I can't do it because of FERPA. I'm like, well, do you know what FERPA says? No, it's FERPA. Well, maybe it's HIPAA. Knowing what the laws allow and what they don't allow is tantamount for understanding when you could share and when you can't. And there are ways to get around that issue with lots of privacy technology. So I'm not saying that privacy isn't important, and I'm not saying we shouldn't think about privacy. But if the first thing you do is lead with HIPAA or FERPA, you probably close down the conversation rather than open it. We have to think more broadly. We have to think about opportunities here. Security and data breaches don't help either. Equifax, thanks a lot. Data hacking and ransoms where data fall into the wrong hands is certainly an issue. The senator raised that. We certainly know that this is happening in our world, but but remember early on I said one of the opportunities for data sharing is to increase trust, not think about this as breaking trust, right? So if everyone is thinking, oh, my data are the best data and nobody can have it but me, how does your data, as best as it is, add value to other people? How can that happen? Next slide, please. Privacy enhancing techniques. You should know, everybody should have pets. Pets, privacy enhancing techniques, not kittens, are being developed to help data sharing efforts. Some with the ability to share insights without having to share the actual data. Imagine it. No HIPAA, no FERPA required. Differential privacy. Add random noise to the data first, then share. Federated analysis. Share insights without sharing data. We become groups of federated analysis. You share yours, I share mine. Insights go into a pool. Homomorphic encryption, where we transform the data first in your own organization, and then you share the transformed data, but the transformed data has the same properties as the original data, but it cannot be sort of identifiable, and you can still do analyses at your organization with somebody else's data safely, without worry of FERPA and HIPAA, right? We're still in compliance. Next slide, please. I like to call this slide, blessed are the receivers of information. The types of societal problems that we face as members of a modern community cross multiple sectors, and we often find that the best solutions address multiple issues, like health and education, not just health. Long gone are the days we have already cherry-picked the tree for single-factor problems. We are no longer in a society or in a world where we're just solving one problem. We've gone too far now. We know that problems in health are related to education, or can impact education, or education is impacted by health. If that is indeed the case, and you are an education organization, how can you do your work without health data? You need data from multiple sources to be effective. Receiving health-related outcomes from another organization may be helpful if you're in your planning and scoping phases. Sometimes people say, well, let's reinvent the wheel. I'll collect health data now. I'm an educational organization with a long-standing history in the educational space, and suddenly I'm going to become a health sector expert overnight because I need this for my project. When there are hundreds of other health sector organizations better, but not in the education sector, you're the best. So why not partner and share information rather than reinvent the wheel, right? That seems expensive to do. Geolocations, I used to live in St. Louis where there are lots of food deserts actually, and this is really inspired by that, that experience. Geolocations of supermarkets along with poverty-related economic data at the neighborhood level and food inventories may create a more efficient identification of food deserts and may enable more targeted interventions to fight hunger. The thing is with data sharing that I think is so inspiring, and I'll show you some examples of this in just a moment, is that if you think about your budget for the work you do, how much of it is going into evaluation and planning, and how much of it is going into interventions? I would argue that if you try to reinvent the data wheel and collect data that others could share with you through an agreement, you are stealing money away from the intervention pot. You are having to reinvent the wheel that costs you money. That money is taking away from the interventions that you could be doing. So I say that the return on investment for data sharing is how you can keep as much money in the pot for intervention work as you possibly can. This is how we must think about and be motivated by the strategy and the rationale for even thinking about sharing and having difficult conversations around that. Next slide, please. So how can we share data better? Data sharing can also help us validate hypotheses about the world around us, right? We can get more information and start to think more broadly about variables that could affect what we're trying to intervene on. Following Hurricane Katrina, for example, volunteer groups of New Orleans were able to save time and money on their rebuilding efforts by comparing pre- and post-storm mailing data from a marketing company called Velasas. Velasas keeps administrative records on housing units and the mailing addresses. That file gets updated by the Postal Service every quarter. So they had pre and post data. So rather than try to go to houses that don't exist anymore, they used the administrative data first to scrape or to scratch their working file for the intervention. Then they kept going with interventions that were to houses that still existed. Without that data layer there'd be lots of inefficiencies in the field work, lots of it, and maybe very ineffectual. Next slide, or next click. Next. Let's count the ways. Anybody use Waze? At a local level, the reason why I love this example, right, is this is citizen science at work. This is the local level where there's a two-way data exchange involving millions of users in more than 1,000 cities. And so essentially, they coordinate these responses to traffic accidents. Data on accidents and road conditions are sourced from users. They're subsequently anonymized, so you don't have to worry about FERPA, HIPAA, or HIPAA, and shared with governments for use in infrastructure and planning. Governments, agencies in turn, provide data on maintenance efforts back to users to allow them for better route planning. All those little under construction signs are sourced from government agencies, not from the users. So this is a two-way street here. We are getting data and we're sharing data, and it's worth it, right? How many of you are like, oh, I'm so glad I checked with Waze. I avoided the potholes. Okay. So I'm going to talk a little bit about some successful sharers because I think it will motivate you to understand how this is even possible in local communities like ours. The Data Science for Social Good partnered with the City of Chicago's Department of Public Health to create a predictive analytical model to determine homes that were most at risk for lead-based paint hazards. So they could alert homeowners to have lead tests. How else do you know? You bought your house, somebody says in the disclosure, I have no idea if there's lead in here. How do you know? Data for good, so cool. Columbus, not too far down the road, I guess it's a bad word here, but I'm going to say it anyway. Columbus, Ohio, launched the Smart Columbus operating system that is an open data platform where residents can contribute their own data to the city government. Now that sounds scary. Right? You've heard of Big Brother, but this is Big Sister and her cousin. So you're going to give your data to the government. Why would you do that? Well, think about it. Thermostats, smart planning, other kinds of things. Maybe the city of Columbus can work a deal with a power company and think about times at which power is cheaper for people based on smart grid or smart thermostat home usage data. You give the data that you feel comfortable giving, the city will try to use it how it can. The trust has to be there, though, that this will work for public good, right? So you have to keep people accountable for this. The New York City Department of Health and Mental Hygiene is linking new and existing data sources from multiple sectors at the neighborhood level. These data have already been mined to identify specific, smaller areas of the city where disparities in health outcomes are present. Now, here's the kicker. Prior analyses of such data at the community district level had not revealed these disparities. It was only when they were able to link at a smaller area of geography that they could actually see where the disparities existed. Now, their intervention programs have hotspots to focus on, and they can get funding for that focus. Next slide, please. The Allegheny County Data Sharing Alliance for Health is building a connected data warehouse across multiple sectors and linking these data to cardiovascular risk factors. A common modeling platform will be offered by the University of Pittsburgh School of Public Health to allow analyses to be performed with warehouse data for a wider audience. So no worry about software, no worry about the data doesn't fit my vendor. No worry about that. They're building a warehouse and they're supplying software to interface with the data in the warehouse so that everybody can have a common rubric for cardiovascular risk surveillance and interventions at the county level. Amazing. Vanderbilt University's Department of Health Policy is developing an infant mortality risk model for their local area that is powered by data linked from multiple sectors, including public health, social services, criminal justice, and others. So Vanderbilt's model is similar to Allegheny's model, but they're focusing on infant mortality, which is a big problem in their area. And they're trying to solve this problem. But notice, the solution to the problem isn't one university or one department or one kind of data. In all of these examples, you will hear the phrase over and over and over again, multiple source or multiple sectors of information together. This is what we must do to combat complicated problems in a society like we live in. Problems are too complex for us not to, and data are readily available if we would be brave enough to share. The Cleveland Health Home Data Collaborative, so this is another area in our state, Cleveland, just down the road, is developing a new healthy housing data system that enables physicians, public health officials, and the public to easily access collaborative, useful information to address health disparities with a focus on asthma and lead poisoning, two health risks in that area that are important. Data generated from these types of aggregated warehouses and models can also be collected over time to influence future funding. So the data that we generate, these models, these warehouses, etc., they also have data that are generated by their use and how effective they are over time. That information can be used to tweak and improve the process. Next slide. So I want to give you some resources for how you could jumpstart the sharing process, and then I'm going to close with some things to think about as you grapple with the sharing ideas for your own organizations and navigate this conference. The Coleridge Initiative, which is a fairly new organization, was established at New York University to work with local governments to facilitate the better use of data in public decision-making. The link is here. They've created an administrative data research facility where community organizations, governments, and universities can share and access data to address pressing social problems. They are handling data security and data privacy issues on behalf of organizations. They're working with organizations to train them on how this is possible. This is a great resource for us. Next slide, please. The Data Access Sectors for Health, or DASH project, seeks to support communities seeking to integrate data and information from across multiple sectors. How many of you have ever heard of DASH? You should dash on over to DASH because this is so incredible. They facilitate sharing of models, methods, and approaches of data sharing across multiple sectors. They have many people who are working, they have many community projects that are ongoing right now. And the idea is that you can get infrastructure support, funding, and advice on how to do this at the local level in your community. That's what the funding is for. Next slide, please. All in Data for Community Health is a learning network of communities that are testing exciting new ways to systematically improve community health outcomes through multi-sector data aggregation. There are 150 examples on their website of communities like ours that are engaging in projects. Some of them are from Ohio. Next slide, please. Thank you. So how can we think about sharing? How can we prepare to share? Just as democratization of data is an evolution, data sharing outside of your organization is going to be a winding, often challenging, and sometimes brave and bold journey, no doubt. But the value of your data may be apparent to your organization, but it may also be apparent for different but important reasons to another organization. This is where the focus on diversity of thought matters. Somebody else from another organization with another lens on another health outcome that you don't necessarily look at normally could look at your data and see value that you don't even know exists, thereby adding more value and some extrinsic value to your data. Rather than collecting all the information you need for a study, intervention, or proposal, why not ease the expense by sharing data with other organizations with similar goals? Next slide, please. There are so-called sharing collectives involving a smaller number of organizations that have agreed to share information for the benefit of all. So you don't have to share with the entire community. Pick a few friends and share with them. This way you can ensure that you have data connectivity, you have data harmonization. You can start small, but the idea is not to reinvent the wheel with all the data that you would need to collect for interventions or their evaluation. Information need not be individual, but can represent individuals in aggregate. But what does aggregate mean? Is it at the household level? Is it at the community level? Remember that example from New York. They defined a neighborhood unit that was acceptable to organizations in the collective, and that unit allowed insight at a local level that was never possible before. Next slide, please. How does your organization store or archive data now? So a couple of things to think about when you're going through this in your own organization, having a conversation with people. Are you locked into one vendor, as we mentioned? Does that vendor have generic formats or repositories that can be accessed by non-vendor software? Asking people what vendor they use for their data is important in the conversation. You don't want it to stop because of that. Let's think about ways around that. What outcomes are you measuring and why? If you can't share data, share outcomes. Let's talk about the outcomes that you care about and measure well. If any of those resonate with me, then the conversation can go to sharing. But I first must know who I can share with and who I need information from at the outcome level. Now, I would like to sort of think about turning the conversation on its side for a moment. Don't think about privacy first. I know this is probably taboo in a place like this, but if all we care about is privacy, we may never get to the sharing. To be honest, we must be real about that. And privacy is important. I work in privacy space, but the point here is that we can't just focus only on that. Rather, think about the bigger picture. What type of data do you need to be more effective in serving the clients you serve? Ask that fundamental question. If that data is available to you, then great. If it isn't, it gives you a space to think about who to share with and who to ask for sharing. Lead with what if rather than but we can't or but HIPAA or FERPA. Almost finished. Taking the next step. Advances in data sharing safely and effectively continue to develop. Remember the pets, right? We all need pets. We need to continue to develop our conversations around data use that are as complex as the problems we are trying to solve, clearly. Data-driven efforts shouldn't be our goal, though. I'm a data person, and I don't necessarily believe in the data-driven hype. Interesting. Our goal should always be to solve the complex problems that are facing our communities. However, some of these problems will require more data than any one organization has. So to say you're data-driven is going to be difficult if you don't have data to put in your trunk. We still must solve these problems, though, right? The data are not the only answer, right? They're only part of the solution. Gathering all the data we need ourselves without sharing puts a lot of resources in one basket, while the basket left to solve the problems is nearly left empty. Next slide, please. What if we could each have a smaller basket that is well curated, has high quality information that is relevant and timely, useful and accurate? Focusing attention on how to share information from these smaller baskets could free up resources to help us continue to solve the real-world problems we are facing. So here's to putting cool data in your smaller basket and for pushing yourself to figure out how to share what's in there, one small step at a time. So a little data sharing can make room for more caring. Thank you.